Hi everyone, my name is Irene Avila, and for this PowerPoint presentation, I'll be talking about binge drinking among college students. During this presentation, the topics we'll be talking about is what is binge drinking, why is this a public health concern, who are the college students at risk, what are the consequences of binge drinking, and what kind of prevention programs and strategies there are to prevent this health problem. First things first, let's talk about binge drinking. The NIAAA defines binge drinking as a pattern of drinking that brings blood alcohol concentration, also known as BAC, to 0.08%. To make it a more simple explanation, binge drinking can be visualized as 5 drinks or more for men and 4 drinks or more for women in the span of 2 hours. College students drink at least twice this amount, which is called high intensity drinking. The reason I chose to focus on binge drinking in college students is because it is the most common among younger adults aged 18 through 34 years old. And it also is because we are all college students ourselves. Why is this a public health concern? The reason this topic is a health concern because binge drinking is related to many alcohol problems for college students. With this being said, the NIAAA stated that college students have a higher binge drinking rate than non-college individuals. They also have a higher incidence to drive under the influence, which is not only a serious risk to themselves, but to others that are also driving on the road. According to the CDC, binge drinking is the most common, costly, and deadly pattern of excessive alcohol use in the US. Another interesting fact is that 9% of full-time college students meet the criteria for AUD, alcohol use disorder. Who are the college students at risk? Everyone is aware that people do experience peer pressure at some point in their lives to reach that social image. We also have to consider the fact of the amount of stress each of us reach within our school years. Knowing this, the most vulnerable are freshmen at the beginning of their school year. Specifically, the first 6 weeks is a very vulnerable time for heavy drinking because of student expectations and social pressure. Another factor are students who are in or associated with Greek systems and athletic programs. We hear a lot of stories about students who have to drink an excessive amount for their initiation, as well as these associations having many social events, which can lead to peer pressure to keep that social image. Talking about the Greek system, students living among sororities and fraternities have the highest alcohol consumption compared to those who live with their families. What are the serious risks of binge drinking? There are some very serious risks that come along with binge drinking. Below are some risks, which are car crashes, alcohol poisoning, violence such as homicide, suicide, intimate partner violence, and sexual assault, along with STDs, unintended pregnancy, chronic diseases such as high blood pressure, stroke, heart disease, and liver disease. And it can also cause cancer of the breast, mouth, esophagus, liver, and colon. It can also lead to memory and learning problems, and last but not least, alcohol use disorders. Going further into severity of binge drinking, let's talk about some consequences of harmful college drinking. Consequences are death, assault, sexual assault, and academic problems. If you focus your attention to the right, you'll see some statistics. According to the NIAA, 1,519 students die from alcohol-related injuries. 696,000 students are assaulted by another student who had been drinking. About 97,000 students report experience alcohol-related sexual assault or date rape. 1 in 4 students report experiencing academic difficulties due to alcohol. Some prevention programs include Alcohol Anonymous, Smart Recoveries, and some strategies are individual level interventions, which can be education and awareness programs, cognitive behavioral skills-based approaches, motivation and feedback approaches, behavioral interventions by health professionals, and on an environment level strategies focus on targeting on a campus as a whole, a student body as a whole, to help prevent alcohol binge drinking. My references are from the CDC and the US Department of Health Services, the National Institute on Alcohol Abuse and Alcoholism. Thank you.